Hi, welcome to another episode of Beyond the Stethoscope. My name is Adrienne Kiss and I'll be your host today. Joining us to help unpack this complicated relationship is Dr. Anna Zakharchenko, a psychologist with Trinity Health Mid-Atlantic. Thank you so much for joining us today. I'm really looking forward to talking about this topic with you.
Adrienne, thank you for inviting me. I'm looking forward to our chat.
Thank you. What are some benefits that you see to social media?
On a personal note, I think if there wasn't any social media, I probably would miss the opportunity to FaceTime my family in Italy. So that is one way, it's one way to connect people. And I think that for myself and my own personal use, it connects me to my community, to people that I'm not able to see on a frequent basis, and keeps me in tune with community events, cultural events, and just things that are going on in the local area, as well as staying connected with loved ones that are much further away than I would like them to be.
That's such a good point, that sense of community I think a lot of us get out of social media. So on that note, though, it can draw you in, right? So maybe you log on to say, oh, I want to check in on my family member in Italy, and then 45 minutes later, you look up, where did the time go? So do you think that that's something that social media is designed to do? Why do you feel that this happens to so many of us?
So there are algorithms used in social media that are on a variable reward schedule, which would be similar to, let's say one is gambling in a casino and there's a slot machine. It is designed to present particular hits to draw one's attention away from, let's say, the object of their initial attention. And that is what I would call, those are artificial dopamine hits that one gets drawn in. Our attention spans over time can shorten because we are looking at different kind of visually stimulating cues and really losing track of time. So it's the variable reward system that is in place in terms of the algorithm. And that is part of what draws people in. It is it's a way of getting a dopamine hit, which is really not the best kind of dopamine hit. There are other ways we can do that in life. So say, for instance, dopamine is a neurotransmitter that's related to reward and motivation and effort. And there's a qualitatively different experience when we've finished a project that we're very proud of or an accomplishment. We've been gardening for an hour and we've lost ourselves in the task and the beauty of it. But we're walking away with a different sense of reward in comparison to scrolling on social media, where afterwards we just may feel kind of overloaded. We get a dopamine crash afterwards, and we may not have as much motivation to go on to the next task.
I feel that personally. You're right. An hour of gardening versus an hour of TikTok, I think. The gardening you feel fulfilled after. It's a great point. So do you think that that's something that social media is designed to do? Why do you feel that this happens to so many of us?
So there are algorithms used in social media that are on a variable reward schedule, which would be similar to, let's say one is gambling in a casino and there's a slot machine. It is designed to present particular hits to draw one's attention away from, let's say, the object of their initial attention. And that is what I would call, those are artificial dopamine hits that one gets drawn in. Our attention spans over time can shorten because we are looking at different kind of visually stimulating cues and really losing track of time. So it's the variable reward system that is in place in terms of the algorithm. And that is part of what draws people in.
I know myself, and I've heard many others say that, they'll log off of social media and feel actually pretty good, like connected, maybe learned something new. And then there's other interactions that you walk away from and you just feel drained. Do you mind to tell me, in your professional opinion, like how do we parse through those experiences when we log off?
So I think if there's been excessive scrolling, again, there's that dopamine hit
Right.
and that variable reward ratio. And so then that can actually be exhausting. Or if you're scrolling through tragic news, that's exhausting. If one has, let's say, a nice FaceTime chat with a loved one, and that's uplifting, I can see where one would leave that interaction and feel better, as opposed to having scrolled for a long period of time, and then one has very little cognitive energy at the end of that, and who wants to go back to work?
Right. Yeah.
I think in the workplace, one of the things that we might see is that, yes, people are staying connected via social media, but then how well are they actually attending to the work in front of them?
Absolutely.
So those are my thoughts on what can be potentially uplifting and really what's draining.
Yeah, so it's very multi-leveled then in the experience.
And then there's the dopamine crash after
sure.
that, after you've been scrolling. So then your brain kind of really needs a reset at that time.
Absolutely. So are there any ways that you've experienced in your professional work, ways that social media can help people with their mental health?
I think there are online support groups that can be quite helpful. I know that we're moving into using AI in developing therapeutic tools, and it's in the infancy stage. I think we have to put a lot of guards in place.
Absolutely.
But I think that it can be used productively to connect people who might be feeling isolated.
So in terms of how social media can actually harm our mental health, do you have anything that maybe you talk with some of your patients or your students in terms of like a checklist, like something you would maybe want to check in on yourself to make sure that you're feeling okay, that social media is not disrupting your mental health?
So I think it starts with self-awareness and self-monitoring. And I would think about actually keeping a log of how long one has been on social media and kind of logging the time, and really looking at how that time has potentially interfered with the things that you want to do in life. So say, for instance, if one has spent a great deal of time on social media and they've not attended to a work task, and that's interfering with your work, then that really is something to be of concern about.
So say someone has kind of gone through this checklist, some of the protocol that you said, just things to ask yourself, check. And I know my phone at the end of the week, it tells me my screen time and which apps you've been on. So I thought about that as, something to add to people's checklist. So say you've determined that you do have maybe an unhealthy relationship to social media. What's one thing that you would tell a patient or a med student to do right away?
I think, as we had said before, putting those limits into place is really, really critical. And then checking to see if one's mood has actually deteriorated after coming off of social media, after doing this scrolling. And when you feel comfortable, maybe sharing it with your primary care physician or a friend, and really looking at the amount of time and how it's affected your mood. For someone who has significant depression, logging onto social media endlessly really would not be something that I would recommend.
If someone has determined that they have an unhealthy relationship with social media, at what point would it make sense to approach a mental health professional?
I think the important question is how is the social media use interfering with the person's life, and how is it getting in the way of them fulfilling their responsibilities? So in mental health, one of the criteria points that we use to actually make a diagnosis of a mental health disorder is what we call functional impairments. And when one is seeing that they're functionally impaired as a result of engaging in something, then it's time to consider maybe talking to a friend or primary care physician about this. And even though one might experience embarrassment about it, but really to kind of think about sharing that and maybe seeking some support around this.
Anything else you'd like to add in closing?
During the time of COVID, social media was very important to us. It was a way of staying connected. However, it is not a substitute for human interaction. And as human beings, we all want to preserve our brain function. So just think about what you're giving your attention away to versus what's right in front of you in life.
Thank you so much. That's great parting advice.
Thank you.
Thank you for watching this week's episode of Beyond the Stethoscope. Be sure to subscribe at the link below.